Hello everyone. The next developmental disturbances of oral and paraoral structure, that is developmental disturbances of salivary glands. Developmental disturbances of salivary glands include aplasia, hyperplasia of palatal glands, atrasia, aberrancy, developmental lingual mandibular salivary gland depression or otherwise known as stiffness cyst, anterior lingual depression and xerostomia. In this video, I'll discuss about aplasia, that is your salivary gland aplasia, hyperplasia of palatal glands, atrasia and aberrancy. Then coming to aplasia, that is the first developmental disturbances of salivary gland I'll discuss today. Aplasia or otherwise known as agenesis. What is aplasia? Aplasia means there is a body part, tissue or organ didn't develop normally or otherwise it is missing. So here salivary gland aplasia, that means any one or group of salivary glands may be absent. Aplasia becomes manifest with the development of xerostomia, that is dry mouth. Then etiology of salivary gland aplasia. Aplasia occurs for unknown reasons, that is your idiopathic, or it can be associated with other developmental defect like hemifacial microsomia, Ladd syndrome and mandibulofacial dysostosis or Treacher-Collins syndrome. Coming to clinical features, salivary loss leads to increased dental caries, burning sensation, oral infections, taste aberrations or altered taste sensation, and difficulty with denture retention. Then hemifacial microsomia. It is a relatively frequent entity and it is characterized by an asymmetric, mild to severe underdevelopment of the craniofacial skeleton, that is the external ear, facial soft tissues including the parotid gland. And it also involves the structure derived from the first and second pharyngeal arches. The majority of cases occur sporadically, but rare familial cases have been reported in hemifacial microsomia. And next one is Ladd syndrome. It is a hereditary autosomal dominant syndrome, and L stands for lacrimal apparatus, usually demonstrates occlusion of the lacrimal puncta, nasolacrimal duct obstruction with overflow of tears, lacrimal sac inflammation, that is also known as dacrocystis, and lacrimal gland aplasia. In Ladd syndrome, A stands for auricles that are deformed with the ear having a cup-shaped appearance, and there is some hearing loss. D stands for dental, peg-shaped teeth, hypodontia, enamel hypoplasia. Various combinations of salivary gland agenesis with varying degrees of xerostomia. Then D, that means digital deformities like deviation of the fingers medially or laterally, that is your clinodactyly. Next is mandibulofacial dysostosis. It is familial in origin. Patients have a symmetric notching of the lower eyelids with the eyes slanting downward at the lateral borders. There is maldevelopment of the mandible and maxilla, and there is a defective development of malar bones that results in bird-like appearance, and often salivary aplasia is seen. That is the Treacher-Collins syndrome or mandibulofacial dysostosis. Then coming to treatment plan for salivary gland aplasia. Treatment for this is supportive and directed at relieving xerostomia and its side effects. Sometimes salivary substitutes, frequent mouthwash, comprehensive dental care, fluoride therapy, and good oral hygiene, these are all play a role in successful management of salivary gland aplasia. Then hyperplasia of palatal glands. There is an unusual localized hyperplasia or hypertrophy of minor accessory salivary glands in the palate. There is an increase in size of the gland. What are the etiological factors like your endocrine disorders, your gout, diabetes mellitus, menopause, in hepatic disease or Sjogren's syndrome. Then clinical features of palatal gland hyperplasia. It presents as a small localized swelling and measuring from several millimeter to 1 centimeter or more than 1 centimeter in diameter. Usually it is present on the hard palate or at the junction of the hard palate and soft palate. The lesion has an intact surface and it is firm in consistency, sessile in nature and normal in color, that is pale pink in color. Usually patient is asymptomatic, there is no symptoms, no pain, and the patient may be unaware of the lesion. Histopathological features. The mass or the tissue appears microscopically as closely packed collections of normal appearing mucus acini with the usual intermingling of normal ducts. There is no inflammation, no spillage of mucin, and there is no fibrosis. Treatment plan. Because hyperplasia of salivary glands cannot be differentiated clinically from a small salivary gland neoplasm in this area, it is essential that they may be excised for microscopic examination. There is no further treatment is necessary and the condition is reported not to recur. So the next developmental disturbances of salivary gland, that is aberrancy. Because of the widespread distribution of normal accessory salivary glands in the oral cavity, it is difficult to define the condition of aberrancy. Since accessory glands may be found in the lips, palate, buccal mucosa, floor of the mouth, tongue and retromolar area, aberrancy may be constructed as in which these glands are found farther than normal from their usual location. There is no clinical significance to be attached to the aberrant salivary glands. Other than that, it may be the site of development of a retention cyst or any neoplasm. Occasional cases have been reported in the literature of salivary gland tissue present within the body of the mandible. In many instances or any example, this glandular tissue anatomically communicated with the normal submaxillary or sublingual gland, generally through a stalk or pedicle of tissue which perforated the lingual cortical plate. Okay, so these are all about the developmental disturbances of salivary glands. And in the next video, I'll discuss about xerostomia in detail. So thank you so much for watching.